Welcome to Touching Lives. I'm Dr. Brian Bell, President and CEO of Arkansas Hospice, which is now becoming LifeTouch Health, and really honored to host this very first episode that we have here today, and also honored, and it was fitting, I believe, that we really start where this all began, where the vision and the compassion that started this organization. And with that, we have today Sharon Aureli, who's our chair of the board, and she's also the wife of our late founder, Michael Aureli, who started this great organization. So Sharon, welcome today. Thanks for spending time on this very first episode, the inaugural, and thanks for all you do for this organization and all your husband did during the time that he started this.
Thank you.
So let's get started. So for those who didn't know Michael, let's talk a little bit, describe who he was.
I used to always tell everybody he was the closest thing to God on earth that I knew, because he was just such a great, humble person. I think that he had a beautiful spirit, a character about him. People would tell you he never said an unkind word. It always reminds me of the movie As Good as It Gets, one of my favorite movies. And in that movie, the lady said to him, you make me want to be a better person. And that's what Michael had an effect on people. He made people want to be better people, just being surrounded by him.
I didn't come here. I got here after he had died, but that's what I've heard. There's such great stories. We talk about what would Michael do, and those stories kind of permeate through this organization still, even years after his death. So, but tell us what led him to found this organization.
I think it was definitely an act of faith, and after much discernment, he left the priesthood and felt that there was something more, a bigger calling to serve. He completed his master's in healthcare administration, and he was drawn to hospice care. I think it went back to the day when his mother had cancer. He had taken her to the doctor's office, wrapped up in a blanket, and they said, there's nothing else we can do. And he thought, surely there's something else that can be done at this point in life. Mm-hmm. And so when he finished his master's, he started a position at hospice, and just from there, his passion just continued to grow.
So what did he kind of see as the need for the mission? What kind of got that mission going in his mind, along with that story that you just told? What else did you see for the mission?
I think, his vision for hospice care, he always started out with a mission and a vision and a plan, no matter what he did, even as a priest, not really having business experience, but that was always what he did. So the mission to enhance that quality of life for those facing serious illness and being surrounded by loved ones and embracing them at this time in their life was definitely his mission. The vision was to just be a better leader in hospice and palliative care through education, innovation, and transformation for the patient, family, and the community. At Arkansas Hospice, of course, the values that we have are life, and that L, which talks about compassion, the integrity, and respect for all those relationships, faithfulness and stewardship to people, talents and resources, and then just excellence, the quality of care that we provide for these patients.
Yeah. So I also understand that a couple of things that it was important to him, that it was going to be a not-for-profit hospice, and it kind of started with the inpatient center was the kind of the impetus. Is that right?
Yes, that was at the time not available in the state of Arkansas, and there are certainly those people who cannot, get the care that they need, in the home. They don't have the people or the family or whatnot. So I think that was definitely top on his list to open an inpatient facility that could care for those people who had no other choice of care, receiving care at that time in their life.
Yeah, I think that was definitely important, definitely well ahead of his time. There was back in those times, not an inpatient centers, a lot of those in the whole country at the time. So, Tell us, what ways was he ahead of his time and his thinking, and what was kind of revolutionary or evolutionary maybe more in his thinking about hospice care?
I think the concept of hospice care had its roots in the 11th century when it was adopted by the Roman Catholic tradition as a place of hospitality for the sick and dying. The first hospices were believed to have been established during the Crusades, which is interesting.
That is interesting.
But we all, or anybody that's in hospice knows that Cicely, if I said that right, Cicely Saunders,
Yeah.
founded the first modern hospice, and more than anybody else, she was responsible for establishing that discipline and that culture of palliative care. She introduced effective pain management and insisted that dying people needed dignity and compassion and respect, as well as just the rigorous scientific methodology in the testing of treatments. St. Christopher Hospice opened in southwest London in 1967. It's now one of the many, but is still kind of the leader in the field for hospice care. So it was her personal achievement, and that's what's been imitated all over the world. I think it was really touched by what her vision was.
I use a lot of her quotes. She's one of my favorite people in the world. And what I love about her, she really introduced this interdisciplinary concept. And she was interdisciplinary herself. She was first a social worker, then she became a nurse, and then she became a doctor. So she kind of saw that whole interdisciplinary approach, and within her, she embodied almost a large part of our what we call interdisciplinary team that we have on hospice. So, I use a lot of her quotes a lot and speak a lot about her. Just, she's an inspiration, I think, to anybody that's been in the hospice work and what she started, and, pretty amazing. And where we're at today, where she started back in the 67 in London, how it got here is pretty amazing. You're right. So
she was a true visionary for sure.
She was doing that.
Yes.
So what do you remember about the early days of Arkansas Hospice?
So I just recall all the different little offices they had. The first one being off of Markham, and there were just 3 staff members at the time. And there was a moment when they were not sure that they were going to be able to make it. Which is where the wind chime story comes in, and that is when a young lady came to the office who was very enthusiastic, very full of life. This was 30 years ago. She was selling wind chimes, but back then, that was her goal, to get enough money to go to college, and people sold things, door to door or place to place, and he was just touched by her enthusiasm. And so he bought a wind chime for $7, which still we have, as everybody knows, at the hospice office today. And the young lady said to him as she was walking out, she turned around with a big smile and said, "This is going to bring you good luck." And not that he necessarily believed, in good luck or that type of thing, but sure enough, the very next day, they received a check from the sisters, who donated a nice portion of money that honestly kept them going, kept the mission and the vision going. So we like to remember the wind chime story.
Yeah. So when I started here in 16, you come in here, this beautiful, nice office, beautiful, and there's this random wind chime sitting up there in a corner. There's nothing that describes it. You just see this wind chime, and it took a little while. I was like, well, tell me about the wind chime. And that's the very exact wind chime that he bought, and then through his faith, that wind chime and the faith, we're here today. So when you look back on the history of this organization to today, what would he look back on it and say about our organization today?
Definitely think that the growth and the expansion and depth of services that we now provide, from hospice to palliative care consult teams and in-home visits that include primary care to the personal home care and the aging in place services. Most importantly, the agency stayed true to its mission and continues as a not-for-profit hospice. Or program at this point.
So you're saying this new continuum of care, there's more services were offered to more people, he would be excited about
embrace.
It, sounds like. He would embrace it.
As a nonprofit. That was very important to him.
Yeah, I think that's so important. There's very few, nonprofits 20 years ago, it was probably, I don't have the exact numbers, 20% of were for profit and 80% for not for profit, and now that's flipped to it's 80% for profit and not for profit. And so I think that's, for us, is a very important to keep ourselves as a not-for-profit, that all the financial, if we gain anything financially, can go back into our families, our communities, and into our employees. So I think that's a great.
But he would definitely embrace it, absolutely.
Well, we're going to take a quick break right now, and after this break, we're going to go to one of the co-founders, Dee Brazil-Dale, who's going to give us some more information about our organization and her thoughts about it. Thank you.
Healthcare is changing, and Arkansas Hospice is changing too, impacting more lives in more ways. Since 1992, our trusted team has grown into the state's largest nonprofit provider of hospice care. Now, we've expanded our services into personal care, primary care, and palliative care, all with a new name, LifeTouch Health. Because when patients and families need more from us, we become more for you. LifeTouch Health.
It's time to party at the Plaza. Saturday, April 25th, 1:30 p.m., Argenta Plaza, North Little Rock. Starring a family reunion of performers. American Idol winner Chris Allen, The Cleverleys, Rodney Block, Janine Latrice Perez and The Sound, the Rocktown Sparks, and Shannon Boshears. There'll be food trucks, family fun, the Care Fair, and more. All supporting the mission of LifeTouch Health. And admission is free. Visit partyattheplaza.org for more information.
Welcome back to the Touching Lives podcast. We have Dee Brazil-Dale, one of the co-founders of Arkansas Hospice, now LifeTouch Health. So welcome, Dee.
Thank you. It's good to be here.
Great. Thank you for coming. So just got to ask you a question. What was it like working with Michael in the early days of Arkansas Hospice?
Those were really heady, exciting days, but very stressful.
Yeah.
Because we didn't know how long we would be around. Mm-hmm. And when the original foundation board asked Michael and I to go out on our own, try to do this thing, to bring the first hospice home to Arkansas, we had limited funds, limited space, and it was exciting. I think that Michael, he had a special ability and history. His history in the decades of being an effective and beloved Catholic priest really helped attract a lot of community leaders. Right. That history plus his mission, passion for wanting to care for people facing life-limited illness.
Right.
And so we were both claimed by the mission, and a door would close and another would open. We'd think, we're not going to make it. And our first model, we didn't know even the direction, and how would we do this? And so we thought, Michael came up with the idea that we would fund and build the hospice home, and all the hospices in Arkansas could use it. And then Medicare mandated that in order to be a hospice home, you had to be a home care hospice as well. Right. So that changed our direction. We did some trips. We went to Mississippi to look at a nursing home that had converted into a hospice. And we went to Florida and looked at an up-and-coming, really great program home. And, all those things infused us with more energy to
got you excited about it, right?
Yeah,
it sounds like that. You just needed to see something out there that's working and going, and that's exciting. Yeah, I gotcha. Yeah. Well, great. So through that whole experience, you made it work, right? Right, because we're here 34 years later.
We often said providence. We didn't want to say, fate, but providence must have had a part. And we talked years later about all of the uncertainties and anxieties and stress. We had some stressful times, and we were sort of like brother and sister through that. And we would have those conversations. But we talked about how our abilities meshed somehow to do what we were able to do.
Yeah. I think a lot of times you see that with people with opposite abilities that synergistically work together, but it sounds like that's what y'all were. Y'all both had great talent in different areas, and you brought them together to do something really incredible.
And every once in a while, when we'd have staff meetings, and he'd say something, I'd say, "No, Michael," and he'd say, "All right, Dee, how was it?" And one of the nurses said, "You all are like an old married couple," and we both simultaneously said, "Ooh."
So, that's a great story. Yeah, I think sometimes you have those relationships. At least you had a great relationship, right? It was one of those where you could be that way with each other and not take it, personal. It's business.
Yeah.
And it was fun and hard and all those things. So tell me, how have you seen the serious illness, this arena around serious illness? How has that really changed since you started Arkansas Hospice with Michael back then? What have you seen change in the industry?
Well, I've been out of it for so long, been retired for so long, so I don't have the big picture.
Mm-hmm.
But one of the things that I am so aware of is that when we were doing this in the 90s, there were many small community-based hospice programs in Arkansas.
Right.
And now it seems like the national for-profit chains have replaced so many of those. That's one thing I'm certainly aware of.
Yeah, probably back when you started, and I don't know the exact numbers, but it was probably 20% for-profits. Now it's 20% not-for-profit. So that number has switched really in the last 20 years, even even since you started. So I think if you go back to 34 years ago, it was probably even 90-10. 10% were
When I
for-profits.
first started in Idaho, it was all nonprofit. Volunteer, because there was no funding.
Yeah. So from the beginning of hospice, that was it. It was all nonprofits. Before it was even funded, it was volunteer organizations coming together, volunteer nurses and doctors and social workers. So yeah, that definitely has been I think a huge evolution change. Seeing that, I'm proud that we can still be a not-for-profit hospice here in Arkansas and representing that segment in the country here.
I wanted to look at my notes here because I get scattered sometimes, but the fact that Arkansas Hospice is the largest nonprofit, not just in Arkansas, but in the region, is a tremendous, makes me so happy and so proud that you're carrying that, those non-funded things that make up hospice, like the volunteer program and the grief support, the community outreach, that I think have fallen by the wayside in many, many areas, and that we're doing it in a big way. It's just, I'm so pleased with that.
I think we put a lot of effort, especially in our bereavement grief program, which is, I think a lot of times when programs cut back on things, that's the thing they cut back on, which really shouldn't be, because that's a really important part of the mission, or our mission, is to make sure we have qualified counselors that do grief and bereavement work. And I've said this multiple times where I've as a physician, sat with patients and they may be older and they don't know, what's going to happen to my spouse when I'm gone. We don't have kids, our friends have died, and I say, hey, we're going to be there for them, right? We're going to be calling them, checking in on them, and that's gives a lot of solace to people when they know that after their death, there's going to be someone, which is us a lot of times, calling in, checking on things. So I think that's really important. So Michael, it sounds like was a really an innovator back in 34 years ago and before that. So what do you think he would think about this rebranding that we just went through, as LifeTouch Health? What would he think about that?
I know without a doubt that he would be in the forefront of making that happen.
Okay.
Because it's an expansion of our mission.
Right.
We were limited with the limitations of hospice, and now that's no longer true.
Right.
So I know he would be right in the middle of it.
Well, I'm proud you're saying that. I mean, we always want to honor him and what he started, but also where we're at today with what we're doing and making sure those things really mesh very well. Anything else you want to share with us about your work you did here years ago, what we're doing now? Anything else?
Well, I feel really blessed to have been led through all of that. And when we were doing it, it didn't seem like like we were, I mean, our nose was to the grindstone. And I can remember one time when we were at the Tobin Center, and Michael and I came out, and he said, "You remember when we would be the last ones in the whole parking lot being?" I said, "Michael, that's still true for me." So the foundation was always playing catch up, and I am so pleased to see how well the foundation is being managed and meshed, and all of the additional programs, the palliative care, everything that you're doing is just makes me really proud and happy.
Because the foundation was your main emphasis then, was the foundation, which we still have today, which plays a huge importance in providing the care that we can, and what I always say, providing the extras. Like, you know, we provide the care on the hospice with our team, but that foundation really comes through with the wants and the needs, and really makes the time that we have with our patients and their families special. We can give them special things that they might not get. So the foundation, I really do feel is still a very important part of it. I mean, it was important then, and just as important now going forward in the future with our new name and everything. So
I want to congratulate you for your leadership.
all right, well, thank you. It's been about a year. It's been a learning year. I tell you, I've learned a lot this year. Made some mistakes, did some good things as well. But I appreciate you. I appreciate the vision that you had with Michael, and because we would not be where we're at today without that, right? I mean, without a start, we wouldn't be here today. And I think a lot of the things y'all did and put in place, and the mission and the vision, and being a not-for-profit, and instilling that, and we still have employees who know both of y'all very well, and there's still a lot of them here. I mean, I think one of the first nurses we ever hired is still here, and so Cheryl's still here, and so, you know, they carry that with them. You know, it's always great to have that legacy that gets carried forward. So I appreciate you coming today, and thank you so much.
Thank you.
It's time to party at the Plaza. Saturday, April 25th, 1:30 p.m., Argenta Plaza, North Little Rock. Starring a family reunion of performers. American Idol winner Chris Allen, The Cleverleys, Rodney Block, Janine Latrice Perez and The Sound, the Rocktown Sparks, and Shannon Boshears. There'll be food trucks, family fun, the Care Fair, and more. All supporting the mission of LifeTouch Health. And admission is free. Visit partyattheplaza.org for more information.
Welcome back to Touching Lives. So let's talk about, we had a name change. So Michael named this organization Arkansas Hospice, and now we're LifeTouch Health and LifeTouch Healthcare, Hospice. What would Michael think about this name change? What do you think about that?
I feel he would just strongly embrace, the growth and how we've had to incorporate all the LLCs that now fall under the umbrella. And so without a doubt, the mission and vision and plan that he had was to grow, and we just now have to incorporate it into a different, name brand, if you will.
Sure. Yeah. Well, kind of what we said, it's not a revolution, it's an evolution. We're evolved into our new name. So I think that's important for us to know, that I think with our growth, that Michael set us on a great path that we're continuing to follow, and that growth has led us to this evolution that we needed a new name. So what do you want people to remember most about Michael? Tell us what that, if they can remember the things, who he is.
Sure. Many people will always say that have worked with him through the years, even within the church life, if you will, that he had a mission, he had a vision and a plan, no matter what it was he was doing. And now at Arkansas Hospice LifeTouch Health, we've been able to touch the lives of over 2,000 patients across the state. I think he would just like to be remembered that there was something that could be done for these patients at end of life, that at the time when his mother was so ill, was not available. Right. And he always embraced that end of life for people. I have a picture of him when he was in his young 20s as a young priest, sitting at the bedside of a dying person. He always wanted someone to be there at the bedside, and someone to be helping as they went through that change in life.
Yeah. So Sharon, thank you so much for sharing that story. It's always great to hear that story. It's always to hear how we got our name and how we got our vision. And it's just great for me personally to be a part of Michael's legacy, to follow kind of in his footsteps, and some big shoes to fill. But thank you today for being here and giving us a story. I think it's important for people to know kind of their roots. As we move to the future, we also got to be kind of rooted in our past. So thank you so much for being here today.
And thank you. And I'll just end on a quote that he did say. He said, "It's an honor to be invited into people's lives to serve them at such a sacred time."
That's a great quote. Thank you so much. Appreciate you. Thank you.